Hello, everybody, both in the classroom, so to say, and also in the virtual space. My name is Klaus Baumann. We start with a little bit of delay due to a connection problem of Zoom, HDMI, and the presentation board or the screen in the classroom. So we try to make it work. My name is Klaus Baumann. Next to me there's Arndt Büssing, who is chairing this session. We have 4 presentations, 2 of mine and 2 of Arndt's, in all of which projects we also work together to some extent. Let me start with our first topic: death reflection and death anxiety, stress and well-being during the COVID-19 pandemic in students, hospital and university workers. We made a cross-sectional study. Let me see how I can continue. Okay. First, we declare no conflicts of interest. This doesn't work. You need to go on here too. The background of our study: as the COVID-19 pandemic has changed daily life globally in unprecedented ways, we try to combine two theories. One, the terror management theory, and the post-traumatic growth theory. The terror management theory by Greenberg et al. Say that the high mortality salience of constant death reminders during the pandemic activates an anxiety buffering system and psychological defenses, while the post-traumatic growth theory assumes positive changes after traumatic events via death reflection, considered as a positive cognitive processing of mortality cues. There have been a lot of mortality cues in and during the COVID-19 pandemic. Our aim is to combine both theories and understand the interplay of the negative, withdrawal-based affective response to death anxiety, to the self-transcendent death reflection response, considered more positive or adaptive. So, taking these frameworks of terror management theory and post-traumatic growth, we wanted to see how the two of these realities react to mortality cues in the pandemic. We aim to investigate the interplay of them in profile groups and to determine antecedents and outcomes associated with both variables. Thus, we wanted to see if there are death profile groups, sort of with a latent profile analysis, in using death anxiety and death reflection. And we wanted to see if there are mediators and moderators in play. What have we done? We made a single center cross-sectional study of prospective kind at Freiburg University and Freiburg University Hospital. It was done as a large online web-based survey. We had the support also of the university rectorate or presidency and of the representation of the employees of Freiburg University, and hence could do it within this framework. Our sampling was done during March and June 2021, during the 3rd wave of the COVID-19 pandemic in Germany. And we asked students, research and non-research staff, and healthcare professionals to participate. We had an operationalization of death anxiety via 7 items of the perceived changes questionnaire, PCQ in the future, and we created a memento mori module, a module with questions about reflection on death. And we operationalized also the death awareness via the 15-item death reflection scale proposed by Juan et al. First of all, in the results, we could, with this heat map, we could show how various groups answered their the different elements of our questionnaire and how they what was their group result. And if you look at the groups we had, the students, researchers, healthcare professionals, administration, laboratory staff, and others, a first striking element that you can observe is that the healthcare professionals don't show more than one sort of best value and only one sort of worst or least value. That is, healthcare professionals had a very low digital media usage, and they sought the connection to others very much. It is very interesting that we had highest values among students, as for example, as to physical activity, but also as to praying. Their gratitude and awe scores, like others, was highest. Their spirituality had the highest scores. Reflection on life. What we could have expected was the high digital media usage, but what you also can observe is their high motivation to help and to live, and their wish to create a legacy for the future. In our opinion, this is very interesting, but maybe it is due to our convenience sampling. It is not representative. We had students from all faculties, but some faculties were more active. For example, we had a disproportionately high group of theology students, of theology students and students of theology and philosophy, and they would be reflecting. Okay, so you see these are sort of the high values and the lower values among the different groups of our staff. Thank you. It is interesting to have this because we had about 1,800 responders. So the participants, the number of participants is very high, so that this heat map has at least some value, though it is not a representative sampling. Among the students, about 10%. But for praying, that's already done, probably just already a group which increases the values on prayer. A more important question for us was if there are profiles of people who sort of use various strategies. And we had three, in fact, we had 3 groups. We had, first of all, the group of the disengaged responders to death cues, these here. Okay, maybe you can, is there, okay, it is the lowest line. The disengaged show low levels of death anxiety and of death awareness. Sort of, you can say they are distanced from all these death questions. Then we have the big group, 44% of calm reflectors. who show middle levels of both death anxiety and of death awareness or death reflection. Their death anxiety is lower than their death reflection. The same is true for the anxious reflectors. Their death anxiety is lower than the death reflection, but they show high levels in both realities, in their death anxiety and in their death reflection. In the sampling which we could use for the analysis of 1,700 responders. So now we had looked how these three profiles were distributed in our sampling. First of all, you see we have the students probably, or the young staff who responded, who are anxious reflectors, while the other age groups are either disengaged or calm reflectors. The youngest group, which was of considerable size, was not as a tendency disengaged nor calm, while we see only one group, the age group 60 and older, it was not possible to identify a profile for them because the group was too small. As you know, at the university, usually people go into pension at latest at 65, and it's usually a smaller group, which is 60 and older. Yes, it was online. They could have answered, but maybe, and it is a free choice for all of them. Probably if we could have recruited all of the staff at university and university clinic, as well as students, we could have had about 35,000 people at least. But probably not all of them saw the link or were willing to answer. But we were very happy with this big size that we achieved. As to gender questions, it is women who, as a tendency, are anxious reflectors, while there are more calm reflectors and disengaged among the men, which may be well understood, maybe also due to some reflections on gender roles, maybe, or gender cliches. As to the occupation, what we already have seen with the youngest age group, this is confirmed here. Students are usually anxious reflectors. Living alone is also a factor to become an anxious reflector, as well as having had the infection. Those who had the infection either became anxious reflectors or became disengaged, saying, well, I managed this, it's not as bad, and so on. And finally, those who experienced that somebody close to them had died from COVID-19, they became either calm reflectors or anxious reflectors. Then we made comparisons between the profile groups, and it is a bit a complicated graph, but if you look at the well-being scales, you see there is nothing of importance for us. Sort of all of the groups are similar as to their well-being, whatever their profile is or death profile is. As to the stressors, we have only one important difference, which is the difference between those who are disengaged versus those who are anxious, which is sort of self-explaining. Whereas in the perceived changes questionnaire, we have an important and very interesting area. This area between 0.5 and 1, this is already important, and what is beyond 1 is the most important difference and impact on the perceived changes. The reflection on life is much different between the disengaged and the anxious, which is also self-explaining, but it is a confirmation of what we found as death profiles. So with all of these results, let me conclude. First, students emerge as the group reporting the most negative impact, but also the greatest amount of positive changes and developing positive resilience during the pandemic. Reports of negative health impact of the pandemic disregard the potential of growth, for meaning making, may buffer negative effects. Spirituality and benevolence may play a crucial role in this, as we have seen in this big chart on the different elements of our survey. And healthcare professionals are not a particularly burdened group, maybe due to their professional competencies and in consequence due to their higher subjective stress habituation. You know that in the public and in the mass media, it was also always on the healthcare professionals, but it was not them, at least not in Freiburg. In one of the centers of the corona pandemic in the first waves, in Freiburg, the clinical staff seemed to cope very well in comparison to the subjective answer tendencies of other groups. Then we have a beneficial role of death reflection of one's own mortality when confronted with mortality and the finiteness of life. We could gain 3 profiles, and it seems, as we have seen, that faith is not relevant for these death awareness profiles. There are age effects, and healthcare professionals are more often in the disengaged group. The starkest contrast we have between groups is on reflection of life scale. The mortality cues are associated with life satisfaction and increased distress via the mediator of death anxiety. I don't show you the slide on the mediation. There is a graph, but that would make things more complicated. If you like to see them, I can show you later on. Death reflection. Because we are on two, you have to skip them. Yeah. Death reflection attenuates the negative effect of death anxiety on life satisfaction and buffers anxiety effects on pandemic stress. That means it's a good thing to reflect on it. Death reflection is linked with post-traumatic growth with a longer range perspective via life review element. And the spiritual dimension in death reflection and positive aspects of being confronted with the finiteness of life in the pandemic, they need further investigation. Of course, our survey has limitations. We only have a cross-sectional evidence, no longitudinal data, which would be very much needed. On the other hand, it is not easy to undertake such research. And our sampling was non-probabilistic. We had probably an oversampling of certain groups. This is sure among the students, because of the 25,000 students, we don't have a representative mix of faculties. This has been our research group. And finally, we thank you, and I look forward to our discussion. If you are interested in one of our new books, this is online, it's on spirituality, ethics, and social work. It's freely accessible on this DOI. Thank you very much. And now I wonder if there are any comments or questions in the chat. Let me see. Pardon me? There is a chat in the Zoom. Yes. No, not yet. I'm using the Zoom platform, but muted and with no video, is the last chat comment. Death reflection is part of death awareness. This is in the scale. That means the death awareness scale as a whole has a death reflection part. Great, good question. Thank you very much. Freiburg was a hotspot in the first part of the COVID pandemic, because the university clinic was one of the, I say, best clinics in Germany to treat this disease. They were very successful, although there were also quite a number of losses. All the difficult cases were brought and were flown into were transported, but they were also even flown into Freiburg Clinic, and therefore it was very important to get also our healthcare personnel to answer our survey, because it's to get a more of a complete picture rather than only journalism, because it was a very tough situation for them, for the physicians as well as the nurses and all who were working for people with corona or with other diseases too. They had to be managed too. And we don't know of any other similar study in a German city with a university clinic or of the same character. I don't know of anyone. Therefore, we started this, and as you know, it's not always easy to get cooperation on a large scale, and we were very, very happy to have this single-centered study. At least it gives you one picture. As a whole, in Germany, we had several hotspots for the treatment of corona. Why? Yes. Yes, due to it is, well, I need to be a bit cautious about this, because there were also reactions on this hypothesis, but we knew that the closeness to Switzerland and the closeness to France, with higher incidences and open borders, seemed to have created some more contagions. But there were also xenophobic reactions, therefore. Therefore, I'm not sure if this is true, and if it was true, it was, well, the virus doesn't respect borders, of course. But we had no, it was a big factor, but we cannot compare our results to others. But due to the size of the sampling, we are confident that it is very much worthwhile communicating them, both within Freiburg region as well as in Germany and internationally too. With the healthcare staff, Well, we have wonderful healthcare staff, and they got a lot of sympathy, and they coped with their stress very well. You can say this in comparison to other groups at Freiburg University. And they are more on the detached side of the death reflection profiles. I think many of them in this clinic have been well prepared for such a situation, because for many other health or disease situations, they are well prepared. It's their daily work. Even we have all of our cancer wards. They are well prepared for this, because they're always in the clinic. Usually they face questions of life and death, much more than in the faculties of the universities, or in the administration of the university. For the university clinic, it may be a bit different, but it shows that the healthcare professionals, as to the question of death reflection and death anxiety, they are well prepared, at least to deal with it. If it is healthy for them, we don't know it, because we have seen that as to the well-being, all of the groups of all the death reflection profiles, all of them have similar well-being. It was not, there was no important difference as to their styles. And this was a surprising result too. Please, Ant.